Dr. Joe Kosterich, GP, and also on the steering committee for the GPCE. A couple of new sessions this year. One is Stroke a Focus, which looks at prevention of stroke, which is obviously what we want in general practice, trying to avoid people getting strokes where possible. So looking at atrial fibrillation, looking at some of the newer anticoagulants and their role, because I think it's fair to say there has been a little bit of confusion and people are wondering which is which and which is the best one to use. So it's an interactive module. It's one of the learning modules. So a number of aspects which are worth looking at. Also new, looking at diabetes mythbusters, and there's so much talk about diabetes out there, even for us GPs. It can sometimes be hard to sort of sort out what's reasonable and what isn't. And so debunking myths is something that's very useful as well. Another new aspect this year is looking at palliative care, and again, with an ageing population and notwithstanding preventative efforts, increasing rates of cancer, something increasingly that GPs are having to deal with. Hot topics, again, in general practice, it's always the things that we're dealing with every day. And probably common things are obviously diabetes and eczema. So how are we managing with treating atopic eczema and dermatitis in Australia, and any new approaches to that? Yeah, this is sometimes not seen as, if you like, an inverted commas, sexy topics, but so many people have it at all age groups. So new ideas around that, certainly that makes it a hot topic. Making the complex simple. Now, I think we all have complicated and busy lives, so anything that can be made a little bit simpler is a good thing. So again, looking at that in diabetes with different regimes, again, some of the newer agents, introducing insulin, how can we make some of these complex regimes a little bit simpler? Again, it's going to be a very, very hot topic. And probably a third one is looking at COPD and asthma in general practice. Again, very 101 stuff, but it's what we do every day. So again, helping us with the new ideas on separating these entities, diagnosis, and obviously ongoing management. So again, something to probably suit everybody depending upon your interests. So essentially, the two-day GPCE in Perth provides a great opportunity for doctors, I suppose from anywhere, but certainly from those in Perth and from Western Australia and regional and remote areas, to come along, meet with their colleagues, and do a lot of learning in a couple of days. So you can really get a whole smorgasbord of different topics. And of course, you can choose what interests you best, and also, if you've identified particular areas that you want to learn more about, then select those. Now, in addition to that, obviously you can find out what's new in the industry through the exhibition display, and as I mentioned at the top, meet up with some of your colleagues. Now that's valuable for everybody, but particularly those who may be practicing in more remote areas.